Talk. Hello everyone, I'm Dr. Manish Shetty, consultant physician at SL Raheja Hospital of Fortis Associate. I welcome you all for this talk that is the monsoon related illnesses on waterborne disease. This is our third talk every year that we do in relation to monsoons. Well, monsoons bring in the much needed rain in India. They fill up our rivers, they nourish our crops, and also give us relief from the scorching summer heat. Though these showers are welcome, they also bring along potential health risks. Among these health risks, the most important is waterborne illnesses, which can affect thousands of people in urban and rural areas. So, today we are going to talk about this. The main question is why monsoon? Why does the incidence increase in monsoon? Well, the stagnant water in monsoon season is a very rich breeding ground for bacteria, virus, and parasites. You see contaminated water sources, inhygienic sanitation, and the for waste which is lying around can increase the risk of these infections. Whenever a patient comes in contact with this polluted water or consumes this water, they are more prone for waterborne illnesses, which can be quite severe in the younger age group, elderly age group, and patients who have immunocompromised status. Today, I'm going to talk about a few diseases which are common and which are waterborne. First is diarrhea or dysentery. Well, it is a self explanatory term where the patient on contaminated water consumption or food consumption can present with severe loose motions. Sometimes these motions can also have blood. So, this is caused by various viruses, bacteria, and protozoa, needs immediate medical attention, and needs proper hydration. Second illness is typhoid. Well, we have heard about typhoid at many forums. This is caused by the bacteria caused as Salmonella typhi. Presentation of typhoid is high grade fever, which lasts for at least a week. Patient has a lot of weakness, may have vomiting. Diagnosis is by clinical examination and also by doing blood tests like blood culture, and in the second week doing a Vidal test. Timely medications, antibiotics will help to cut down the complications of typhoid fever. Next illness we talk about is viral hepatitis. Well, viral hepatitis is the affection of the liver caused by hepatitis virus A and hepatitis virus E, both of which are spread through water and food contamination. The presentation, these patients may present with fever, they may present with stomach pain. On inquiry, you will see that there is a high colored or yellowish urine, and also there is a yellowish coloration of the eye or jaundice. Blood tests in this case will reveal that the liver bilirubin is quite high. The liver enzymes SGOT, SGPT, which is usually in say 30 or 40 normal range, are in thousands. So a timely diagnosis and understanding the way the disease will progress will help us to treat the patient well. One word of caution with hepatitis E is that it has a severe form of illness in pregnant ladies and in young children. So, whenever you are diagnosing a patient with hepatitis E in this special population, you have to be extra vigilant. Next disease that we talk about is cholera. It is caused by Vibrio cholerae, well, commonly also called as HESA. It was a very rampant disease in the past, and outbreaks. It was an epidemic of cholera which used to come where there was severe loose motions, 30 to 40 episodes in a day, and the color of the motions used to be white. It is called as rice water stool kind of motion. So, fortunately, with special attention to sanitation and all, these incidence of cholera has decreased. Cholera is a notifiable disease. As soon as we diagnose cholera, the test it is a hanging drop method where we look at the stool, and this is a notifiable disease. The authorities are informed, and there is a mass screening of patients and surroundings when there is a cholera outbreak. Last disease, which is Not exactly waterborne, but it is due to contaminated water, is leptospirosis. Leptospirosis is a disease where there is a spirochete which is shed in the urine of rats, and this in flooded waters. When we walk in flooded waters and we have a cut or some bruise in the leg, something, so you can get leptospirosis. Well, leptospirosis presents with severe fever, headache, vomiting, jaundice, and muscle pain. Early diagnosis and timely treatment will prevent a lot of complications. Having understood this 4 or 5 waterborne illnesses, now what is the way forward or what do we do? Well, first, most important thing is you should identify the symptoms and seek medical attention. If there is loose motions, please hydrate yourself well till you see the doctor. We have oral rehydration solutions which help in restoring the imbalance in the electrolytes and the water. You should, if there is fever, please get your blood test done to identify the cause of fever. We have lot of monsoon related illness in terms of dengue, malaria, chikungunya, leptospirosis, typhoid fever, and also a timely diagnosis with blood test is important, and treatment. In terms of prevention, well, it is going to be a joint effort between the community, the government, and the individual. Community measures before the onset of monsoon. The government and the BMC undertakes a lot of cleaning drives. There is the drains are cleaned, decloggation, and also water sanitation is looked into. There are door-to-door surveillances in case of outbreaks. There is regular reporting of cases, which helps us to identify clusters. So the government also sets up monsoon clinics in along with the other regular hospital beds. There are monsoon beds which are allotted for early treatment, admissions, and also door-to-door tests are also done. So this is quite a good opportunity for us to get tested and to be vigilant about the diseases. Secondly, it is an individual responsibility. First and foremost is to drink clean water. So water has to be boiled, filtered, bottled water. Look into your surrounding for any contamination of water sources. Secondly, the food that you consume should be properly cooked. It should be fresh food. It should be hygienic food. Vegetables and fruits should be washed thoroughly before consumption. Third is hand washing. Very important to maintain hygiene. Well, before you have your food, hand wash. After you use the washroom, hand wash is very important. See that there is no stagnation of water around in your surroundings and all, which will help notify diseases to your authorities early so timely action can be taken. A word about immunization. Well, some of the monsoon waterborne diseases are preventable. We have vaccinations for typhoid, we have vaccinations for hepatitis A, and also rotavirus vaccinations for diarrhea. Be open to discussions with your doctor for preventive measures that you can adopt to maintain good health. So, to conclude, monsoon brings in a lot of hope, growth, and rejuvenation. But you have to be aware and you have to be cautious. Awareness of waterborne illnesses and taking simple preventive measures to control this can help you enjoy the monsoon and also not fall ill. Monsoon is very important for us, but so is our health. So being aware of your surroundings, aware of the diseases, timely action, timely medical attention will go a long way in keeping you healthy. So in this monsoon, stay safe, stay clean, stay healthy, and enjoy. Thank you very much.